Hi everyone, my name is Eliza Pastor, and today I'm going to inform you about epilepsy and seizures. The reason for my speech is I would like people to know the facts about seizures and epilepsy. I suffer seizures and most of my family has had it. Within minutes, the attack is over and the person regains consciousness but exhausts in days. Few people have experienced or matched the drama of convulsive seizures. Epilepsy is a brain disorder in which clusters of nerve cells and neurons in the brain sometimes signal abnormally when someone has experienced a first seizure. The doctor will usually order an EEG to determine what type of seizures the person may have had and if there's any detectable abnormalities in the person's brainwaves. More than 2 million people in the United States, about 1 in 100, have experienced an unprovoked seizure or been diagnosed with epilepsy. For about 80% of their diagnosed with epilepsy, seizures can be controlled by medicine and surgical techniques. While epilepsy cannot currently be cured for some people, it does eventually go away. By my past experience, I had seizures when I was 10 years old, but with medicine and a lot of testing, blood taking, my seizures eventually went away. One study found that children with idiopathic epilepsy or epilepsy with unknown cause had 68 to 92% chance of becoming seizure-free by 20 years of their diagnosis. Epilepsy can be prevented by good prenatal care, including treatment of high blood pressure, infections during pregnancy, can prevent brain damage in the developing baby that may lead to epilepsy. What do you do if someone has seizures?
Call the police?
You can call 911. That's one point.
Put a pillow under their head.
You can raise their head. Put a cushion.
You pull them to their side. Make sure they have something in their mouth so they don't swallow their tongue.
Well, if you see someone having a seizure with convulsions or loss of consciousness, here's how you can help. You are correct. You can put a cushion underneath their head. You can roll them to the side to prevent choking or any fluid or vomit. Make sure to loosen any tight clothing around their neck. Keep the person's airway open. Do not restrict them because they can harm you or they can harm themselves too. Remove any sharp objects around them and know how long the seizures last. That's very important because when you call 911, they're going to ask you how long the seizure lasts. Make sure to stay with this person with the seizure until the seizure ends. If you call 911, they will ask you if the person is pregnant or has diabetes. Did the seizure happen in the water while they were taking a shower or a bath? Did it last longer than 5 minutes? Any seizure starts before the person regains consciousness. If this was the first seizure, or you think it might be, if in doubt, check to see if the person has medical identification. Some people have special braces on their hands or around their arms, and it will detect if the person has seizures or not. After the seizure ends, the person will probably be groggy and tired, or he or she also have headaches or might be confused. They didn't know what happened. You can lose consciousness. Be patient with the person and try to help them or find a place to rest if he or she is tired or doesn't feel well. If necessary, offer to call a taxi, a friend, or a relative to help the person get home safely.